My name is Tori Cooper. I currently work, I guess I'm an advocate. That's the title that gets thrown around a lot. So I do a lot of work in the community. I also do consultant work with the CDC, with NMAC, and a number of different organizations. And I am super honored to be a part of this incredible panel today. So thank you all for being here.
Thank you for having us.
Yes. So the goal of today's session, we're going to talk a little bit about public health. We're going to talk about HIV and how it impacts the communities that you represent. First thing we want to do is actually have each of you introduce yourselves. Fantastic. So we'd like to first start with Beautiful.
Good morning. My name is Beautiful Devynne. I'm currently a community health worker here in the city of Atlanta.
Good morning, everyone. My name is Freda Jones. I'm a peer specialist in the metro Atlanta area. I've been surviving HIV for 16 years, so I provide love and support nationwide.
Yes, you do. Welcome. And last but certainly not least, Queen Nyrobi.
Hi, my name is Nyrobi Moss, Dr. Nyrobi Moss, how about them apples? And I am a sexual health educator and trainer. I am a CDC published author of Healthy Love, which is an HIV intervention for African American women that looks at HIV prevention and relationships. So in addition to that, I'm also a relationship specialist where I look at sex and sexuality in relationships and what that looks like to build healthy communities.
Amazing. So Beautiful. We know that HIV is a huge issue in the transgender community. Can you tell us some of the reasons why transgender women are at greater risk for HIV, some things that we can do as a community to help support lowering the numbers, and what are some of the structural and social barriers?
I believe living the trans experience in the community, HIV is a really big issue amongst our community because of stigma, basically because without education and letting the transgender community know that they have support from other, whether it's allies or the community within, then it causes the disparities and the barriers to get care. And so without getting care, then people not educated to know the low risk issues that they need to do to stay healthy.
So what does staying healthy look like for a trans woman with HIV?
Staying healthy in living that trans experience to me will be going to your doctor's appointments, staying on your meds, regularly drinking plenty of water, and just living a healthier lifestyle, whether it be mental or physical. And so a lot of, I believe the trans community feel that we're not always wanted in some areas, whether it be the clinics or different support groups. So it's good to build different groups amongst ourselves so we can build each other up and empower each other to live a healthier lifestyle.
So Freda, we know that nationally we're seeing numbers of new HIV infections going down. Some would even use the word drastically reducing. So tell me, what do you see in the community of Black women, Black cisgender women? Here's a term we'd like to introduce to the conversation.
Okay, what cisgender is a woman born female with the cisgender. And with the women and HIV, what I'm seeing now in my office is married women. I'm seeing women in long-term relationships. I'm seeing women, mothers, I'm seeing daughters, I'm seeing professional women into my office. So, and those are the women that's not being seen, out in the community because of the stigma related around a cisgender woman that's living with HIV. So what I've been seeing is a lot of them being kind of hid. They choosing not to come out because of what they are betrayed to be.
So when we're talking about new infections, especially among Black women, because we're Black women, some of us got to our present state of womanhood in different ways. Well, actually in the same way. We got here in the same way. We just may have arrived at different times.
Right.
But with that being said, we also want to make sure that we never intend to stigmatize our partners.
Right.
So, but it is important to understand that Black women who are in somewhat committed or monogamish relationships, is the word I like to use for that, are still being infected or being diagnosed with HIV.
My put on that, and some people may not agree with me, it's not written in the book, it's not in the Bible, this is just what I believe from what I've been seeing. I'm gonna go back to the house, you know, from, let me go back to your parents. In the Black community, the parents, some parents are not making it comfortable for their son to be gay. You don't come in the house and tell me you want to be gay. I want you to be a basketball player. You know, I want you to bring me some grandkids. So now he's faced with that. So now I got to bring Keisha over to my mom. As soon as I bump Keisha off, let me drop her off. Right. Now let me go over here with Tony. Who you really want to be with? Because he's not being comfortable and gay because of what his family want him to give them. And now it's affecting the whole house.
Right.
Now I'm out sleeping with this person on the outside of my marriage, but I have to please my wife also. So now I'm sleeping with my wife also. No, I'm not using condoms over there, and I'm not using condoms at home. So we bringing all of that back into our household, and it all starts from when you're a child. I can't be gay and comfortable because in the Black household, they're not talking about it enough.
That is the reality of some people's existence and some people's journey with HIV. And there are a whole bunch of different stories and different ways that people come in contact with HIV through association. And so I think it's wonderful that we verbalize that. Again, making sure that we're not putting out a message that we're stigmatizing men. Right. Because the issues are far bigger than Black men and sexuality. So Nyrobi, is there such a thing as cisgender privilege? And if there is, what does it look like? And how does that present itself as a cisgender woman who works in and around HIV?
So when you start talking about the concept of what privilege is, privilege would suggest that there is a special right and or passage given to a particular group. Okay, so that's the definition of privilege. And when you start talking about being a cisgendered woman, it's not only just being born a woman, but it's also identifying with the gender that you were born, right? Definitely there is a privilege to that, simply because, and don't get me wrong, there are still challenges being a woman of color and being African-American woman, especially a Black woman, especially because, we have different societal and economic pressures, yes, okay? But set that aside, we start having conversations about the difference between I present as a woman, and nobody's going to question that, right? So even in this age when we start having conversation about trans women, the ideology of trans women has been sensationalized. If you are not, like even on social media, if you're not the uber beautiful one, or if you can't pass per se, then you're questioned. You know what I'm saying? Your womanhood is questioned, and what you being a quote unquote woman looks like is questionable, right? But not only that, as a trans woman, your sexuality is questioned. Because if you're too overly sexual, then you're trying to trick somebody, as opposed to just being who you are. Right? And so therefore, me presenting as a cisgender woman, there's no problem. You're going to look at me, you're going to say I'm a woman, it's okay. You're not asking me to prove my womanness, right? And that in itself is a privilege. And don't get me wrong, we have different issues as far as Black women are concerned, and those are conversations we'll talk about later. But in the vein of the question that you asked about being a cisgender privilege, it just is. Because what is a woman? What does that look like? What is it defined as? And then what are the characteristics thereof? And if you are not living up to this uber beautiful, what society says you're supposed to be as a trans woman, if you can't pass, or if you still have a beard, or if you're not one of the trans women that's so uber flashy where you're super made up, but that is still who you are, then your womanhood is questioned about, well, what do you mean? Because if you say you're a woman, you're supposed to look like a woman. You know what I'm saying? You're supposed to have your eyebrows together, you're supposed to do all these things in order to prove your femininity. Does that make sense?
It does.
So what I'd like to hear from you is expound on that a little bit more and tell us how you feel that relates directly to HIV and perhaps even HIV risk.
What's interesting is that I was having a conversation last night, and a friend of mine said to me is that it is not the oppressed group's job to fix the oppressor. When you have conversations about the context of not only even race or sex or gender or this rights, where human rights are concerned, right? From a black perspective, it's not my job as a black woman to fix racist people. It's racist people's job to fix themselves. And then, because you're oppressing me, right? So when we start looking, because I was literally on the pushback, like, no, I know plenty of women that, I have no problem with what they have going on, and I'm some of my best friends, some of my best friends are transgender, right? So there's this context where a friend of mine said, but trans women are not the ones that have the problem. So if they're not the ones that have the problem, and if it's all the rest of our attitudes, our feelings, what we put on them is oppressive, is stigmatizing, is pushing you into a place where you can't speak your truth, where you can't say what your truth is and walk in whatever your light or your truth is, then it's not your job to fix me. It's my job to fix me and my cohorts, right? So we start having conversations about what that looks like as far as HIV is concerned. You have trans women who are being murdered at a higher rate. You have trans women who are being stigmatized at a higher rate, and then there's this social belief that these things become okay because you tried to trick me anyway by not telling me that you were trans, right? And then that, in turn, makes it, well, it's not okay, but I can understand, right? Which means we buy into that level of oppression. We know that based on socioeconomics, based on stigma, based on a lot of other pressures, that the number of HIV rates rises. We know that people make sexual decisions in the dark that are not necessarily the best sexual decisions, which leads to increases in sexually transmitted infections and HIV. We know these things, right? We also know that when we create socioeconomical barriers for people, like a lot of trans women that I know have been and or were and or are sex workers. Simply because where can you go get a job being you in your true self? Or go get housing being you in your true self, where I'm not saying, or even if you go to jail, I get to put you with the males even though you identify as a woman and you feel safer as a woman, but I have to go by what's on your driver's license, right? So all these barriers that we create, trying to hold on to our space, trying to hold on to the fact that, most people say, that's like the abortion question, where they say, well, I believe in abortion, I believe in a woman's right to choose for them, but not for me, right? So it's the thing, well, I don't care what people are. I think everybody ought to do what they need to do. You know what I'm saying? That's how you feel. You want to be a woman, that's okay. As long as how you feel doesn't encroach on what I think I need to be doing, or doesn't threaten what I consider to be my own womanhood, right? This is the prevailing topic, and the reason why we keep coming back to that, even like in the battle between cisgender and transgender, like what is that topic and what's that dialogue, and why do now I have to be cis? Because you're trans, right? And of course there's an answer to that, which we'll talk about that coming forward. But these barriers that we create, these places where we try to protect space that doesn't need to be protected for whatever reason, are the places that we create an environment for HIV rates to rise, for murder to happen, for socioeconomic barriers. So now you're forced into, sex work. So you're forced into these places where not the best healthy sexual decision making is happening.
I'm hearing things from what you all are saying, and there's similar messages that are being said. I think I've heard the word stigma 5 or 6 times already. So what I'd like to hear, first, Beautiful, would you tell us a little bit about stigma from the Black transgender woman's perspective?
Oh my God, I can go on all day with that.
Well, we don't have that long, but I would love for you to tell us a little bit about it, please.
Stigma in the trans community, it could start at the door of a clinic. As soon as you walk in, if there are no trans affirming people welcome you into the establishment, then you're not gonna go back. And if you don't go back, then you're not gonna be on top of your health care. You're not on top of your health care, you're not living a healthy lifestyle. So I think it's very important when you go into these different places, whether it be the clinic or it might be a mental health establishment that people know to respect you and your pronouns, because if they don't, then 9 times out of 10 that trans person is not going to come back.
So again, tell us a little bit more. Why is that so important, other than the fact that they're not coming back there? Why is that so important, especially for a trans woman who's living with HIV?
I mean, it's important because if you don't feel affirmed going to receive your health care, then you're not going to go back. And if you don't go back, then you're not going to be on top of what you need to do in order to live a better lifestyle. So it's important that people respect the person they see in front of them when they come in, so they want to come back.
So if I am a trans woman and I'm going to a clinic, I'm going to get a test or I'm there for care, and I am telling someone, so this is who I am regardless as to what my ID says, then it is important out of respect, that word again, that you honor who I say that I am. Because if I don't feel respected, then I won't come to your establishment. And that's for a lot of people.
And it creates barriers.
Talk a little bit more about barriers, please, and then I want to go to Freda.
Barriers are really something, because when you create that barrier, then that add on top of everything else that you have going on, because living the trans experience is already something, because you have to deal with how people view you, and basically you just want to live your life as who you are, that makes you comfortable inside. And why does this person over here care about how I want to live my life? Because I'm not even thinking about you. I just want to be who I want to be. And when the barriers are created, then it just adds to everything else. Healthcare, housing, jobs. So then that creates depression. And when that creates depression, then a person's like, okay, well, I got all these other things going on. So you know what, I'm just gonna sit in my room and I'm not gonna do anything, because this one barrier created 10 barriers that was already on top of everything else. And once you start creating barriers, and if you don't have someone like a community health worker, which is what I do, to alleviate those barriers, so you can go to health care and you can take care of your mental health and all that stuff, and then you can just be the great you.
The great you. I love that. I love that. So Freda, tell us a little bit more about some of the barriers that Black women, cis and trans, face in HIV prevention, particularly when we're talking about PrEP services, and also HIV care before and after a diagnosis.
Well, with some of the barriers that women face is, you have a variety of things. We have to take care of the kids. We always put ourselves on the back burner. We have to take care of the kids. We have to go home and cook him dinner. We have to make sure, because he has to, rather he don't have to, but he's buying my baby diapers. So I want to make sure he's fed real good, making sure he's taken care of. I'm a single mom. I have to do all these things, trying to work 1 or 2 jobs. I can't go in and get tested because I don't think anything is wrong with me. Right. I'm only having sex with one partner. That's another barrier, and it goes all back into the stigma of HIV as well. Because sometimes we feel like, oh, I'm fine. I don't have to get tested. I only have one partner. And that was my thing. That was one of the reasons why I didn't get tested when I was in a relationship with just one person. Oh, it doesn't apply to me because I'm not a gay white man. I don't use drugs. I like buying shoes. I don't have time to be spending my money on drugs. Right. This was the thing that was in my head. I like shoes. Right. I can't spend my money on drugs.
I think all of us like shoes.
Right. And that was one of the things that was in my head. So HIV didn't apply to me. The lack of knowledge is what's hurting our community. I didn't know. No one educated me about, you're at risk too. There's no such thing as high risk. Oh, you're a high risk female. No, I'm not a high risk. I'm at risk. I'm at risk.
Interesting. So no such thing as high risk.
It's a risk.
So are there people that you feel have a greater chance, without using the word risk, they have a greater chance of contracting HIV than others? And if so, why?
Yeah. No, everybody's at risk. If you're having condomless sex, you're at risk. If you're having condomless sex with one person, you're at risk. If you do not know that person 24/7, you are at risk. I have always said, if you don't know what they had for lunch, you don't know who they had for lunch. A lunch break is 30 minutes. You get to a certain age, you're not giving people 30 minutes.
It's 7 on a good day.
It's 7 on a good day. And 5 of them is foreplay.
Right. Okay. Trying to work
So
up to it. Okay.
I don't like the term high risk. You are at risk if you are having condomless sex, whether you have one partner or 5 partners, whether you are a gay white man or a gay black man, you're female, you're trans, you are at risk if you are having condomless sex, period.
When you start looking at, HIV as something that is prevalent in communities of poverty, right? It is because, of course, we ain't got no money, so what we do is we have sex. You know what I'm saying? It's the cheapest form of entertainment, but it has the most expensive return, you know what I'm saying, on investment, right? With HIV, with sexually transmitted infections, with babies, with whatever, right? And it is always said, no matter where you go, more impoverished communities, of course, have sex more for whatever reasons. And a lot of studies discuss, just trying to escape social pressures and or trying to find some level of peace or whatever, these things that keep us together. So there are a lot of different conversations about that. But communities that have more socioeconomic pressures or barriers to care or lack of access or lack of education or that are disadvantaged have a higher community viral load and have a higher rate of contracting sexually transmitted infections and HIV. So I will agree with you on the fact that if you are sexually active, you are at risk. However, the chance of catching it, the chance of lowering communal viral load, the chance of treatment, the chance of being able to get access to PrEP, the chance of these things are less in communities that don't have the same socioeconomic pressures.
So I think that's really, really valid, and I appreciate what you all are adding to the conversation. And you took the word right out of my brain, community viral load. When we're talking about risk, a lot of times what we're talking about is how much viral load is how many people are living with HIV who have a detectable viral load in the community that you socialize in and with. And so when we're talking about risk, we have to think, again, the undetectable thing, because we know now, the CDC, they finally acknowledged in 2017, U equals U, which a lot of people with HIV have known for a long time. We just didn't use those words. We know when we're talking about community viral load that we're saying the people that I socialize with and sleep with and have sex with, amongst that population of people, there are probably more of them who have HIV and perhaps an undetectable viral load than my white counterpart, or than my cis counterpart, or than my counterpart who lives in a different country. So certainly every person who's having sex, condomless sex, is at risk, and a greater risk is for people who are considered, public health word, marginalized, who have sex with other marginalized people. So I think that's really, really a valid point and something we can't talk about enough. So with that being said, how about we transition a little into HIV prevention, talking a little bit more about PrEP. I'd be interested here, Freda.
Tell us about PrEP, Freda.
Is PrEP a thing? Does it work? Is it relevant in the lives of Black women? And if not, should it be?
It is relevant, but do we know about it? No. No, we don't know about it because we don't think we need it. So Black women don't think they need it because they don't see their face on it. Why would I pick up that pamphlet if my face is not on it? It don't apply to me. How do I know about this pill that'll prevent me from getting infected with HIV if nobody is showing it to me? So we as a community need to do more work with showing it to everybody. I like to be all inclusive. I'm not just caring for my MSM, my men that have sex with men. I'm not just caring just for my women. I'm not caring just for my trans. And those that know me know I care for everybody, and we have to start broaden that message and be all inclusive. Until we start being all inclusive with this message, everybody is going to continue to get infected with HIV.
So if I'm a black sister, I'm 29 years old, and I have 2 kids, I may or may not have one sexual partner, and condoms just don't work for my relationship. Okay. Why in the world would I want to take a pill for something that I don't have?
Because we want to prevent you taking birth control pills because you don't want to get pregnant. So I need you to take PrEP because I don't want you to get infected with the HIV. That's why you need to be on PrEP. It's a 1 pill once a day. I have seen over 2,000 patients that's on PrEP, and no one has converted into HIV. And I have very few women that comes through that office that's on PrEP because they don't think it applies to them.
So I generally use the term lack of perceived risk. Black women, all black women of trans experience, black cis women, many of us just don't realize that we're at risk for HIV. Because I'm having sex with a man who's not having sex with other men.
I would counter that. I would say, I used to have the same conversation about like, oh, we just all don't think that we're at risk. Yeah, we do. There's not necessarily a lack of perceived risk. There is an assessment that something else is more important than our own health, than our own ability to take care of ourselves. Because I have to take care of my kids. I have to take care of my partner. I have to take care of, and we make these decisions inside of these relationships, knowing that may not necessarily be the right way I'm gonna go.
Yeah.
However, what's the alternative? The alternative is me being by myself alone and depressed. The alternative is me not having this other dough to buy them diapers that I need to buy. The alternative is, what's that, I don't care what you do for them, just be good to me. And that same conversation where we will know that our partners have other partners. Right. That's the same context where and I don't even subscribe to this when Madea say, well, how do you know your man's cheating on you, Madea? And she said, do you think he's cheating on you? You said, yeah, that's how you know, right? Well, we will know that there are other people that are inside of our sexual relationships. However, if it does not affect the context of what we can see in front of us, then we don't have a really big problem with that. When you start talking about sexual health and sexual decisions, especially as women, we compromise a lot. We will put a lot of people's needs before our own.
Yeah.
Women of color, especially, we're only going to the doctor if something is falling off, it done fell off, and we can't super glue it back together.
Yeah.
Right? So when we start talking about our, perceived risk, we understand that, okay, this may end badly, right? But my assessment about where I am right now, in my family, in this, because we make these decisions that other things are more important than us and our health.
So one of the things that just dawned on me is I don't know if we even told people what PrEP means.
So the interesting thing about PrEP is it's actually an acronym for pre-exposure prophylaxis. Basically, it is an antiretroviral, right, that surrounds the cell. And of course, HIV medications happen, which I'm not going to get technical in this situation. HIV medications happen in 5 different, they react on the cell level from 5 different perspectives, right? You have your pre-exposure prophylaxis, which means, it surrounds the cell so that HIV, the receptors cannot attach itself to the cell, right? Which is what pre-exposure prophylaxis does. Right. The interesting thing about Truvada and the interesting thing about PrEP is the fact that the babies have been using this in other impoverished communities, in my LGBT communities for years. And actually used to sell these pills on black market. And it wasn't until somebody at the CDC or somebody at these other places said, well, hey, why don't we try this? Because that had been knowledge, literally, on the men who have sex with men roll for years as like a little, let me take this Truvada to keep me from getting it. Right?
May I interject something?
Yes.
Among white men who have sex with men.
Yes, among white men who have sex with men, right? And because I remember hearing about this like literally 10, 15 years ago, okay? And I was like, oh, that's interesting, because that's also the same time we started talking about a vaccine, right? And about what a vaccine is and what a vaccine does. And, so now, fast forward, because I always say that viruses and diseases and things have like a 10 to 20 year shelf life before it gets around the mainstream public, right? Because literally there's information about HIV long before it became really prevalent in the 80s, right? So we'll back up off of that. Well, when we start talking about, it came around the same time we started having conversations about microbicides, which of course is looking at looking at creams and berries and pills and things like that to prevent women not only from getting sexually transmitted infections but also from getting HIV, right? Where we start talking about microbicides, we start talking about pre-exposure prophylaxis, we start talking about PrEP and these different contexts for how do we combat the virus as opposed to just being in it or waiting for women to serial convert.
So to offer a hood translation for what you just said, PrEP is one pill that you take once a day to keep you from getting HIV.
Yes.
Still use condoms because we don't want you to get STDs, which will throw everything off. Beautiful. So since we're talking about PrEP, I would love to hear a little bit about PrEP and transgender women, and then just some myths about trans women, particularly Black trans women, and how those myths play a part in HIV.
A lot of myths can be that some trans women are rude, uneducated, and they just want to have sex and post ads on Craigslist. And typically when you walk into a clinic environment, if the person behind the counter think about that, then it comes off in their delivery. And so then in turn, the trans individual feel like, oh, you just judged me, and I haven't even did anything but show up and try to sign my name. But if you have a person that is fluent and very affirming, they don't see all that. They just want to get you in to take care of whatever needs that you have that need to be met.
So does PrEP look different for trans women?
I think PrEP looks different for trans women just from the educational standpoint. Because in a lot of advertisement early on when PrEP first became relevant, you just see a lot of MSMs. Like in advertisement or you see the pamphlets, you don't really see
White MSM.
white MSM, the two cute little twinks of white boys. And that's all you see. So if we don't see ourselves, then we're not gonna take part in it. Because it's just like, well, I don't know that. But then when you have people that's out in the community like myself and like you young ladies, and they can educate people like, okay, if you test negative, then let's enroll you into the PrEP program. So it just takes that extra step for people that in that position to go about and for people that are negative so they can get them on PrEP.
But I also remember that there was a mandate where we used to not be able to have a conversation about PrEP unless a person had ever so many other risk factors, right? So you remember that? Yeah. Like where it was like, oh well, you know, if they just say, like even on those wonderful bubble sheets, and those of you out there in public health land know about the bubble sheets. Testing the bubble sheets is a whole nother conversation. Yeah. Where on the risk factors on the back, if you just had heterosexual sex or sex with one partner, or even if it was right, it wasn't until you had a couple of other risk factors or
yes.
the person had multiple sex partners, or you've had sex with a trans person, or you had sex with a man who's needle shape, right?
Yes.
That you got to be able to say, oh, well, let's talk about PrEP, right? And there also was a place where doctors wouldn't initiate that conversation with you, and if you asked them about it, they didn't know what you was talking about, or they'll say something like, oh, well, you just have one partner, don't worry about that.
Good. You married, you good.
Right, you don't need all that.
And we still see that.
Right, and so there's a lot to be said for, number one, the places that we put ourselves to educate ourselves, okay, and what that looks like when we advocate for that knowledge in communities, because it really was reserved for the conversation for, like, I've known nurses forever that would, take PrEP when they were in emergency rooms or in those situations, but it was the nursing thing. It was what the medical community did to protect itself from whoever was coming inside of those hospitals or the emergency rooms for whatever reason, right? And so now that conversation is extended out, and we have to make sure that we're part of how we promote and push that message.
When we're talking about MSM, we're talking about men who have sex with men.
Yes.
And that's a public health term, but it also indicates or it includes guys who don't identify as gay or bisexual.
It talks about behavior.
It talks about behavior, right.
It's not the accession, because we all, back in the day, we used to just use the blanket term as gay. Like everything was just, that person is gay. Like, okay, all this, and then, transvestite, you're just gay. It's all gay, right? Which doesn't have respect for actual behavior or action, because gay is a stigma. Like, I'm not gay. That's not what I'm doing. And who I have sex with ain't got nothing to do with it, because gay it's a stigma. It's a whole packaging of things, and that's not who I am.
That's right. And along with, and in that catch-all term of MSM, we know we have gay for pay. We know we have gay for the state, which is folks who perhaps have a history of incarceration, you don't have a lot of options there. And so we want to make sure we're not stigmatizing people, but in this context, we use in public health terms to describe groups of people. And I think it's also important to us because I love black men. I love all people, but I love black men. And I think it's important for us also to acknowledge that all black men aren't on the DL, and all black men with HIV didn't get it
from having sex with another man.
And in closing, one of the reasons why when you have black women, one of the reasons we talk about black men is because from a societal standpoint, those are quite often the men that we have relations with, that we have sex with. Quite often, especially here in the South. We're in Atlanta. And so more often than not, you would see a black woman with a black man than you will a black woman with any other race, and perhaps all other races combined.
Well, black women tend to stay inside of their own circle. Inside their own racial and ethnic groups more often than other people, even though those things are changing, and that's not necessarily the absolutes. But based on statistics and based on where you are in location, we tend to work it out in our own circles.
And all of those things go back to risk. It's not that black women, that we have more sex or more sex with more people, because those are two different things. It's just that we have sex with what is considered a smaller group of people. Folks, we tend to date and socialize and have sex with people that our friends know. Just kind of how it is. So ladies, I would love each of you to give us some closing thoughts about HIV in black women, prevention in black women, and just some things that we can take moving forward.
Closing points for me, education. If we educate our community, whether it's trans or cis, to know the preventive measures or what measures we can take after being diagnosed with HIV will be an awesome thing, and that would change the community itself.
My take-home message would be to get yourself educated about HIV and HIV prevention, meaning educate yourself more about PrEP, what it prevents you, because you know more than anyone else knows your partner. If you know he's coming home at 4 o'clock in the morning with his homeboys or whoever, just educate yourself more. I would encourage all the women to educate themselves more and don't be afraid to know. What I mean by that is don't be afraid to ask those questions. If you're putting yourself at risk. And like we'll go back to what we said earlier, you are at risk if you are having condomless sex.
So my take home is about how we find ourselves as allies, as black women, as cisgender women, as trans women, how we find ourselves in this place where we become allies for each other in these socioeconomical and or barriered fights that we have, right? To start looking at how we are allies to each other and how we move forward to respect, to affirm, and to bond and build together so that we start to overcome some of these barriers, right? To look at the fact that we tend to, in society, separate things out. We're like, okay, these are my issues, these are your issues, and these, but to be able to look at all of the issues that women face, whether cisgender or whether trans, the barriers that women face across all of these different constructs, and to look at how we support each other, how we move forward, how we educate each other, and how we affirm who we are as women and how we can move forward mightily as a unit and as a collective, as opposed to being divided, right? Because we are stronger together than we are separated.
Thank you. And so I'd like to leave us with a couple of things to think about. I encourage all of my sisters, however they got to sisterhood, I encourage us to remember it is not important how a guy identifies that you have sex with, it's how he treats you and the relationship that you two have. I have an aunt who's single, and we were having a conversation, and it somehow got on black men who were on the DL. And so in the conversation, I said, so if this particular man told you he was bisexual, would you date him? Right. She said no. And so it went into a conversation from honesty to deception, commitment, and monogamy, which are all different things. So I'm not telling anybody to go out and have sex with somebody that's bisexual.
No, but it's that same conversation that we say we want people to be honest with us, but you don't want honesty, you want what makes you comfortable.
That's exactly right.
You know, you want what makes you safe and what makes you whatever, because you don't know what to do with the rest of that. Because if I told you that, you know what, I have these relationships, and like, you know, and it's different, you know, for cisgender women, like if we have some little lesbian tryst, that's cute.
That's cute.
Do you know what I'm saying? It's just a phase. It's like, ooh, we can get two girls up in this joint. But when I say something like, yeah, you know, I like to watch. I mean, if you in, I'm in. You know what I'm saying? For what you got going on, then it becomes a whole nother conversation.
Yeah.
Right? And so therefore, we want comfortability. We want the things that we can define, and we want the things that we can explain, and then we fall back into our old isms, our old prejudices, our old...
They don't want it to be shameful.
Right? And the roles, the gender and sexuality and all of these different constructs that we try to lump into all these different male and female or other, right? But there's so many, and I think the terminologies of like how the LGBT acronym or the has continued to add on to it is just testament of that. You have transgender, you have asexuals, you have bisexuals, you know, so all that. And I remember when being bisexual was like, they just said you was greedy.
Right.
We was just greedy, right? We was just greedy, okay, my bad, you know. Not that you were, you know, pansexual or any of these other things where it wasn't happening on this continuum. You know, so, yes.
And again, let's stop stigmatizing guys. Not us, but in general, let's stop stigmatizing guys. Because if a guy wants to date me this month and date Freda next month, my laboratory vagina works, looks, and acts the exact same way that Freda's natural-born vagina does. All right? So we
That's if you chose not to keep both of them. Because I have some friends that, like, so that's what I'm saying. It depends on what you define your womanhood
Girl,
to
we're going
be.
to confuse people.
I know, I'm sorry.
We're going to confuse
Edit all that
people.
out. Go back to her, the laboratory vagina. Go for it. Sorry, my bad. Okay.
So I want to thank each and every one of you, and I encourage every person, every black woman, everyone who I call sister, regardless as to how you got to sisterhood, to take care of yourself. If you're living with HIV or not, taking care of yourself requires going to the doctor. It may require PrEP in your circumstance. It may be required that you're on some HIV regimen, but it means taking care of yourself and prioritizing yourself. Because if you take care of yourself, then you're going to take care of everybody around you.
Everything is falling in place.
Thank you all.
Thank you.
Thank you.
Thank you.